Namaskar, friends. A warm welcome to this special short session with Dr. N. Ganesh Rao on why yoga for senior citizens is not gentle yoga but truly intelligent yoga. I want to begin with something personal. When my grandfather entered his 70s, he would always say, Budapa is Burapa. So this is Hindi colloquial, English colloquial to it is old age is a difficult age. As a child, the sentence used to frighten me. What was coming? What did aging really mean? Yet he followed a steady routine, not just walking, but a disciplined practice of yoga and pranayama. And somewhere he has also influenced me towards this holistic practice as well. So he used to have a disciplined practice of yoga and pranayama, and in 2018, at the age of 88, he passed away peacefully in his sleep without troubling anyone. His life taught me something profound, which is old age cannot be understood only by counting years. It is not chronological. It is emotional, physical, psychological, and deeply, deeply human. Even caregivers say this. Supporting an elderly person often feels like caring for a child who carries enormous wisdom. It asks for patience, compassion, insight, and yes, intelligence. And that is exactly why we are here today. Dr. N. Ganesh Rao, everyone knows about our program, Geriatric Care Specialized Yoga Teacher Training Course, and Dr. N. Ganesh Rao, who leads Module 2 in this program. And this program is also, friends, starting, the batch 3 is starting from 22nd November onwards. So going back to my statement, Dr. N. Ganesh Rao leads Module 2 in this program. And the Module 2 is about psychology and rehabilitation of mental health, where you actually understand the psychological aspects of aging and incorporate yogic techniques that are designed to enhance mental well-being and resilience. This is a 6-month geriatric care specialized yoga teacher training course is a 6 months fully online international program that offers flexibility while giving teachers and practitioners a structured path to understand aging deeply through yoga, psychology, philosophy, and holistic care. So, friends, let's open our hearts and minds for this brief and beautiful session by Dr. N. Ganesh Rao on why teaching seniors require more than gentle movements, but it requires intelligent yoga. Why are we adding prefix intelligent to yoga? So let's hear it from Dr. Rao itself. Namaskar, sir. A warm welcome.
Thanks, Shivani, for that lovely introduction. I will go to gallery view,
Yes, sir.
and may I request all the people on the screen to come on the scene so that I can see all of you and then talk to you. It will become so nice to talk to all of you, looking at you and talking. Namaste, Hiroshi, Kyoko, Matsuo, namaste. Santosh, Shaktivel, namaste. Maccabi, Dr. Dinesh, Gail, if you can come on the screen, it will be nice. Okay. We are wiser in this course, and as far as geriatric care is concerned, because we have already finished one course. And the feedback that we have received is heartening, to say the least. Yeah, it's very encouraging, very inspiring. But keeping that aside, just to familiarize you with what is there in the course and also why the significance of the course attains enormous proportions. Just a few observations I want to make. First of all, when we talk about geriatric care, geriatrics refers to or studies the diseases afflicting older people, aged people. So geriatrics deals with diseases of older people. And two allied terms. One is senescence, which is the organic process of aging. And then we have gerontology, which is the medical study of aging process. So three very close terms. The course deals with geriatric care. So it is care given to the elderly people who are afflicted by diseases which are not accidental, which are not based upon any infections, but which are just plainly due to growing old. Yeah, that is the starting point. Aging is a universal process, a natural biological process, and an inevitable process. A process which is undesirable and not welcome. Death is the natural culmination of this aging process. Whatever you do or don't do, the day you are born, aging starts, and this aging culminates with death. There are several definitions of old age, several characteristics and parameters which describe and define old age. But one fact is unarguable, and that fact is as one grows older, whether one wants or not, several issues arise, issues which are problematic, unwelcome, deterioration of the physical organs, physiological systems, breakdown of mental functioning, psychological problems, social problems. Whether you want it or not, these are natural accompaniments of the aging process. And the most important thing is it's very unfortunate, and I consider it as a fraud played by nature on human beings, that when one grows old, one progressively becomes less self-dependent and becomes more and more dependent upon others. This is very natural. You cannot help it. Very natural. And add to this, what we today look at, the demographic transition, it actually presents a very frightening picture, and that is low fertility rates coupled with low mortality rates. That means the lifespan is increasing, births are reducing, and we are staring at a scenario where the number of older people in society is progressively increasing. In some of the societies, this is already happening, that there are no younger people to take care of the older people. And when this is happening, the onus falls upon people who are providing geriatric care, and the balance is totally tilted, that there are not sufficient resources to take care of the older people in society. They are saying that by 2050, one of six people, six human beings, will be more than 60 years old. The question is, who will look after them? Our present medical care, health care is, naggingly falling short of resources for taking care of the older people. This is the scenario which we are seeing. In this scenario, qualified, well equipped, specialized yoga teachers and therapists, their importance cannot be overemphasized. Absolutely important. Not only this, geriatric care or taking care of the older people is not only an individual family responsibility, but it is a responsibility of the community. It's the responsibility of the nation. It is a moral obligation. If you actually look at it, it's very strange that the human offspring takes maximum number of years to become independent as compared to the offsprings of animals. A human baby takes anywhere between 12 to 10 to 12 years even to stand on its own feet and start thinking, unlike the calf of a cow or the young one of a sheep, which within 4 or 5 days gets up on the feet, starts becoming normal and independent. The point I'm trying to make is each one of us, when we were babies and infants, were looked after by some human beings. Our parents, our siblings, elder siblings, relatives, somebody has taken care of us. So it is our moral obligation also to take care of the older people in society. We have to return something there. In this context, I have a thought, and that is old age should not be looked at as a problem, because I firmly believe if anything is a problem, then there is a solution to it. And if there is no solution, then it is not a problem, it is reality. And reality is not something which you have to solve. Reality is something which you have to face, accept, and find a way of dealing with it. When we talk about healthy aging, two things come to mind. And that is, when I start growing older, can I preserve my health as much as possible so that the retardation in physical and mental faculties is slowed down? Fine, I age healthily. Another way also of looking at it is, can I look at the aging process by itself as very natural, accept it, grow old gracefully, and die beautifully? So one is taking efforts towards your health, one is changing your outlook towards this whole process of aging, because it's not a problem, it's reality. The question is, how do I look at it? How do I accept it? How do I face it? What do I do for it? And when we come to this specialized, a pioneer of its course, for the first time in the world, a course like this, thanks to LMI Yoga, has happened, that we are, specializing in genetic care, which is the call of the day. If we are talking about genetic care, and then we are talking about specialized yoga course, teacher training course, why yoga for taking care of the older people? This is where the strength of the course lies. This is where the strength of yoga lies. Because yoga by itself deals with the human being holistically. All other forms of treatment are looking at human being compartment wise. Okay, the body, the mind separately. Whereas yoga looks at the human being as one whole. Not only that, being in this field of yoga for more than 20 years, Yoga looks at human being much more comprehensively than any personality theory. And if I want to make my point clear, the human being is not only the body and the mind, but there are two other more important facets or dimensions of human being. And that is, in addition to the body and the mind, we have the energy and the consciousness. Yoga has in its repertoire tools, instruments, which not only address the physical issues, not only address the mental, psychological issues, but also address the issues of energy. In fact, I was thinking deeply on a topic which I shared with my last batch, and that is, for you to remain young in life, you require two things, very essential things in life. One is energy, and one is enthusiasm. Enthusiasm is something towards a goal of life, a meaning of life. And second is, you should have energy in you to pursue that goal. If even one of these falters, then you resign to the fact that, okay, look, I have grown old. Now I'm just waiting for death to happen. Lots of time, a person has energy, but has got nothing to look forward to. He or she, this is what happens to a 9 to 5 person at the age of 58, 60, when he's compulsorily retired by organizations. Physically, mentally, he or she is healthy, but what erstwhile from 9 to 5 was occupied with so-called meaningful work, now that meaning is not there. Energy is there, body and mind are okay, but nothing to do. The person grows old, maybe 5 years, he grows old in 1 year's time. On the other side, there are lots and lots of individuals, bright individuals, who have got good ideas, good purposes to realize, but unfortunately, the body is not cooperating. The body has become weak. I don't have energy enough. Both are necessary, energy and enthusiasm. And probably the only approach which caters to both is yoga. Yoga has in its, repertoire, again use the word repertoire because it is a kit where there are practices for strengthening or making your body healthy. Yoga is mainly meant for the mind. Whether you take the meaning of yoga, you take the definition of yoga, you take the purpose of yoga, everything is mind oriented. And that is why when I look at my module, which I am catering to in this course, it's a very, very important module, psychology of aging. Because when the mind becomes weaker, even if your body is healthy, it can't do anything. 95% of physical ailments are psychosomatic. The mind has to be healthy. So, in the aging process, what happens to the psychology? What are related to the mind? What are the problems which are coming in the mind there? Coming back to my topic, not only yoga caters to the body and the mind, but yoga deals with energy. And that is why, if you look at the topic that I am dealing with, psychology of aging and mental rehabilitation with pranayam and other yoga practices. If you look at this word pranayam, it is yama of prana, control of energy. Every pranayam practice, every breathing practices provides you benefits on two sides. One, it increases the energy. Another, it increases your awareness or concentration. This is just the tip of the iceberg. When we talk about yoga therapy, we are not talking about therapy only through yoga practices. Therapy of yoga is enriched, strengthened when the philosophy of yoga also helps the practices of yoga. If we do only the practice of yoga for therapy, it is as good as taking a tablet for a headache. The headache will go, but when the effect of the tablet goes, the headache will come back again because you have not dealt with the cause. And the cause lies in your thinking, your outlook to life, your priorities in life, the management of your desires. Where are you leading in life? yoga is strengthened, is very rich. So one of these parts of the topics that we deal is psychological and philosophical counseling. I mean, a therapist providing geriatric care should be sufficiently enriched to guide, to counsel the elderly gentleman who is there, not feeling okay, not no going through tough times in life. It is the strength of yoga that it provides, ways and means of providing counseling, taking care of the mind of the person. In fact, when I'm talking this, the thought is coming at the back of the mind. If I don't utter that thought, probably I will lose that thought. And that is this therapist of yoga who provides geriatric care. More important than providing care, this person who is providing therapy is also going to grow old. So it is not only taking care of people outside, elderly people who are having problems with age, but it is also taking care of yourself, looking at aging in a very healthy manner and being sufficiently equipped not only to deal with people outside, but also to enjoy your process of aging. Because all of us inevitably are going to grow old. In fact, when we look at the definitions of aging, what is old age? So many definitions, nobody is able to define. Even the United Nations organization does not provide a definition of what is old age. It hovers around, okay, the time of retirement. Organizations retire a person by 58, 60, and probably that is old age. Most of the time, wherever you look at cultures, which are not very, very advanced scientifically or materially, old age happens when you become useless to people around you. When you don't serve any purpose to people around you, you have grown old. So as long as you are able to contribute something to people around you, you have not grown old. And if you ask me the definition of old age, I can say very clear definition. You are old when you think you are old. If you don't think you're old, you're not old. Nobody can, impose aging on you. So the question is, okay, in my own case, in our own case, individual case, this whole course, specialized course, equips you holistically. When I say holistically, the two other modules are so beautifully defined. And fortunately, we have brilliant individuals who are imparting the course. One is the physiology of aging, because that is where the first effect starts happening. One common characteristics of aging, which is accepted by all definitions, is aging is slowing down. Slowing down physically. You can see this. An elderly person for sitting down takes time to sit down, while getting up takes time to get up, walks slowly, makes movement slowly. And this is only on the physical side. On the mental side, you have to see to believe. The comprehension becomes slower, retention power becomes slower, recollecting power becomes slower and slower and slower. So slowing down, in quotes, probably is a parameter or a characteristic which is included in all definitions of old age. We have on one side physiology of aging, where we not only deal with general physiology anatomy, but we deal with exactly the organs and the systems. When aging happens, how do they slowly start naturally deteriorating? And what is the way of looking at it? What is the way of dealing with that facet of slowing down? You cannot help slowing. You can't fight against nature. This is bound to happen. The question is, am I equipped sufficiently? Equipment happens twice, two ways. One is in the mind, knowing what is happening. I find this is the biggest problem. I come across lots of people who say, look, I feel headache. I say, look, headache is a very general term. When you say headache, which part of the head is aching? Is it because of your posture? Is it because of hypertension that your head is aching? Is it because of tendency towards, vertigo, balance losing? When you just say headache, most of the time the problem is I don't know what is the problem. If I know the problem, I can very well go towards solution to it. I can search for solution, take help of people who are well equipped with the solutions. I can go to them there. But not knowing is a problem there. And as Shivani mentioned in her lecture, it is not gentleness towards the elderly people. It is your intelligence. I distinguish intellect from intelligence. Intellect, in J. Krishnamurti's term, refers to your memory, your knowledge, what you have learned. That is your intellect. Intelligence is your response to a situation. Your geriatric care is mainly based upon intelligence. How do you take care of this person in front of you? It is not your knowledge. Okay, one, I have learned about this. No, it is a live example here. It is your intelligence where everything that has gone into you has to be mixed together. There's an alchemy which is happening, and then the solution happens, which is different for different elderly people who are sitting in front of you. And that is the intelligence. Earlier, we used to say, okay, deal sympathetically, take care of the elderly people, fine, all that gentleness is fine. But if intelligence is lacking, and intelligence comes only when you are deeply immersed in this subject, you know the ins and outs of this subject, you practice this practices upon yourself, then you are able to provide, not only solace, but relief and happiness to that person who is growing old. It starts with people who are at home, and then slowly you start, because you find, I can tell you something very important. Having practiced yoga therapy, I've taken 26,000 sessions of yoga so far. Practicing yoga therapy, it is not the fees that the person pays you which is satisfying. What is more satisfying is the relief that you provide to the person. That satisfaction you cannot earn that satisfaction by money. And even if one human being, you are able to bring a smile on that person's face, if you are able to take care of the person, if you are able to provide a way to the person, look, if you are able to live this way, it is much better for you. You'll be more happy. You'll be happier. That itself is sufficient. You have given back the debt to humanity of what humanity has given you. So this course, on one side, I've talked about physiology and anatomy. On the other side, we have an excellent teacher of Ayurveda, where we are not only going simply to the principles of Ayurveda, which you can get from any textbook, but a very experienced person who is bringing this Ayurvedic knowledge to diet and nutrition, which is provided and should be provided to elderly people. Because once you start growing old, you will see that the muscles start becoming weaker, whether you want it or not. A particular patient starts becoming weaker. There is a deficiency of protein. The growth happens slower and slower. So we have a total module which says, provides you, fully equips you with what you are supposed to do as far as diet or nutrition is concerned of the elderly people. So when these three are put together, the three modules, it's a total compact module. And it took at least, 16 to 19 months for this module to work smoothly as of now. Most of the lectures are recorded and we have hybrid sessions. It's a beautiful thing. And the course itself is growing. It's not that once the course is, fossilized. No, the teachers are growing by the feedbacks that they are getting from the participants, and slowly improvements are being made to the course. This is one of the most unique courses. There is one unique in the sense, it is not only unique because it's the only course of geriatric care, but it is also unique because there is so much of efforts which have gone into from all sides for giving this, wealth and treasure of knowledge to yoga therapists as far as genetic care is concerned. Yeah.